So during this video I am going to dissect this heart. So the first thing I'm going to do is show you some of the features on the outside. Now you are going to have to forgive the fact that I don't have obviously proper surgical scissors at home. This is just my chopping board. But I'm going to talk you through the features on the outside and then we're going to have a look on the inside. So this is the heart. And I did get this from school, so it is one of the ones that we have at school. I'll just move my chopping board so it doesn't drip. Now you can see, first of all, you have to kind of try and work out which is the front and which is the back. Now, these are the atria, and unfortunately this one has been kind of chopped up a little bit. Some of these atria at the back are kind of missing a little bit, but generally the blood vessels kind of come out the back of the heart, so we know that this is the back, so this must be the front. This slight discoloration here is just because I had it sitting in a bowl of water and that bit was out in the air. Anyway, so the other reason we can tell that this is the front and that's the back is because these are the ventricles. This bit here, this is a ventricle, and then this is the other ventricle. And I can feel, I know you can't see it, but I can feel on this side that it's kind of a bit stiffer, it's much thicker, whereas this feels a little bit more forgiving. So that tells me that this is the left-hand side and this is the right-hand side. Now normally this would sit in the chest and it would be tilted slightly to one side, but the majority of what you see as being this heart is actually the ventricles. The atria are just these thin little bits at the top here. So there's one there and there's one there. Now obviously I'm kind of holding these just to show you, but they are much smaller because usually blood will enter into these atria and go straight down into the ventricles, and it's the ventricles that do the contraction to send the blood off to the lungs or off to the body. Now a couple of things to note on the outside. This white stuff is the fat. Now that's perfectly normal. It's perfectly normal to have some fat around organs. It helps with protection. Now what you don't want is for this to get too thick. Now this is all still nice and soft. I mean, you can see as I squish it, I'm not leaving massive indentations, it's still quite flexible. The problem is if that gets too thick and it becomes quite inflexible, you then can't get proper contraction of the heart. So if we have a look carefully at the outside here, you can see these lines down here. Now that actually follows the septum of the heart, the band of muscle that separates the left ventricle from the right ventricle also separates the left from the right sides of the heart. Apologies for that noise, that's my dog. And so these lines, and you can see they kind of go off down here as well, they are the coronary arteries. Now obviously we all know that blood is pumped out of the heart and it goes off to the lungs and it goes off around the body, but the heart itself is a muscle. It needs oxygen, it needs glucose so that it can contract, and so we need to have a way of getting blood to the heart muscle itself, and that's what happens in these coronary arteries. So they will branch off the aorta, leaving the heart very early on, and they take oxygen-rich blood to the heart muscle itself. They will eventually drain back in to the right-hand side to rejoin the rest of the circulation. So that is the left-hand side, that is the right-hand side, this is the front, and this is the back. So if we look at it at the back, you can see this would be the left-hand side, whereas if you were looking at someone, this would be the front, and so this side over here would be the left-hand side, because you've got to imagine that sitting in somebody's chest, that would be their left-hand side. Okay? So what I'm going to do is I'm going to stick it down on here and then we're going to chop into it. Now, like I said, I don't actually have a scalpel at home, but actually one of the safest ways to cut into a heart is using scissors, actually. So I'm just going to, actually before I do that, we're going to have a look at the arteries. Now arteries take blood away from the heart and veins go into the heart. Now you can see here I've got two arteries here, and what's sometimes quite difficult is trying to decide which one is the pulmonary artery, and the pulmonary artery will leave the right hand side of the heart and it will go to the lungs. It's taking deoxygenated blood to the lungs. It picks up oxygen. It'll come back into the heart, and because it's now oxygen rich, it'll come back into the left hand side of the heart. It'll come into the atrium. It will go down into the left ventricle, and then the left ventricle will give a really big squeeze to pump that blood out through the aorta and into the rest of the body. So it's quite difficult to work out which one is the pulmonary artery and which one is the aorta. Now you can see they both have quite thick walls. Now the easiest way is to actually kind of poke your fingers in and see where they take you. So if I poke my finger in this one and try to work through that valve, I don't know if you can see, but I'm actually coming through into this ventricle here, which, if you remember, just dribbling, if you remember, is the right hand side of the heart. So blood leaving this right ventricle leaves through the pulmonary artery. So that's taking deoxygenated blood off to the lungs, which means this other one, if I kind of wiggle my finger in here, I don't know if you can see what's moving there, but it's going through into this left hand side. So this must be the left ventricle. That's going to take blood off to the rest of the body, and so this artery must be the aorta. Now if we have a look before I cut into it, I don't know if you can see down there. Try and line this up a little bit in the light. I don't know if you can see that very well, but I can see the valves. Try and get that out of the way. Can you see that there? You can see that that's not just opening up into a cavity. There is something blocking it. There's something in the way. And they are the valves. They are what's going to prevent blood flow. So those valves would open to let blood come out to go off around the body or to go to the lungs. And when they close, when blood gets kind of sucked back towards the heart, those kind of cups, those valves, fill with blood and actually close and prevent the blood going backwards. So valves always prevent backflow. Now, because this has been slightly mangled and slightly cut open, you can see other valves as well. Get this bit out of the way. Now, this is the atrium, and this is actually already, unfortunately, being kind of cut open. This would be an enclosed chamber as well, and I don't know if you can see there, but there's another valve. And that, again, would stop blood from, it would allow blood to go through down into the ventricles, but when the ventricles contract, it will prevent blood just coming back up into the atria, because you want it to go off around the body or to the lungs in the arteries. And again, this one, if you can see down there very well, but again, you've got a valve there. So try and angle that in the light a little bit better. Okay, so again, blood can flow down through to the ventricle, but blood will not be able to come back up and back into this atrium. So let's cut into it. Let me just dry my hands. This has been sat in water all night. Try and get rid of some of the blood. It's just a bit icky. Again, apologies for the noise. That is my dog walking around. So what I'm going to do is just cut through from these atria down into the ventricle. Now, immediately you should be able to see what a really thick wall this has. Look at the wall of the atrium. Now, most of this atrium is actually missing, but you can see that's not a very thick wall. All this has to do is squeeze down to squeeze the blood down into this ventricle. So they don't have to be very thick because they don't have to generate as much pressure and as much force to push the blood just down here. This left ventricle, look at the size of that wall. That is one very thick muscular wall. It needs to generate enough pressure to push the blood out and around the rest of the body. So again, this is another way to see that this must be the left ventricle. We're trying to generate enough pressure to send it all the way around the body. Now if I cut through the other side, scissors aren't very sharp. So there's the right ventricle. Now you can see that wall is not as thick as that one. That is that left ventricle wall, whereas the right ventricle wall is, oops, I'm a bit out of shot, is only that thick. Okay, so if you have a look inside the ventricles, this is that valve. So you can see here, blood is able to flow down into this ventricle, but if this ventricle starts to contract, blood is going to get squashed up into these pockets, and then these pockets, I can get my finger in this other one, these pockets would then close. So if you imagine that as a three-dimensional shape, those pockets are going to prevent the blood flowing back up into these atria. So that's those valves. Now these valves are tethered. They have like these, a bit like kind of guy ropes on your tent. They have these cords, and they are sometimes called your heartstrings, and they hold your valve attached to your ventricle. Now if you imagine blood pushing up through there, if you didn't have those cords, you could actually turn that inside out, and so blood could still come up. Those cords stop that from happening. I mean, I can actually tug on that as much as I like, and I can't get it to flip the wrong way. A bit like if you have an umbrella in the wind, that won't flip the wrong way. So I'm just dribbling slightly. So yes, so they're the valves. And you can only see a bit of it there. It goes all the way over there and then all the way over there as well. Now inside the ventricle, you can't really get this on camera, but that is really incredibly smooth, really silky smooth, and that's to stop resistance. You want blood to be able to flow. When these squeeze, when this muscle contracts, you want blood squashed up and out through the aorta, and you don't want anything to stop that blood flow. You want no resistance there, so that's really beautifully smooth to allow that blood to move back out of the heart. Okay, so that's the left ventricle. Like I say, unfortunately the left atrium is kind of missing a little bit, but you can see there, that's much smaller. The walls are much less thick than these strong muscular walls of the ventricle. And then over on the on the right hand side of the heart, again you've got that atrium there. Atria is one, atrium is two of them. You've got that atrium there, and you can see again that wall is really very thin. It's just going to push the blood down into this right ventricle, and you can see again you have these valves to prevent that backflow of blood. So again, imagine that as a three-dimensional structure. It's going to allow the blood through, but not to come back again. Okay, now I'm going to finish cutting through this because I'm going to cut through the whole of the septum. Just going to clean up a little bit. So, not very delicately done, given that I don't have very sharp scissors. Right, so they are the two halves of the heart. So you can see this is that left hand side. Now look at that septum and that outer wall of that ventricle. Look how thick that is. that's able to squeeze this chamber, to squeeze it from the bottom, squeezing all the way up to send that blood out through that aorta. So blood flows into this atrium, down through this open valve, into this ventricle. When this ventricle starts to contract and squeeze, blood will be prevented from going up into that atrium, and the valve in this aorta will be open and blood will be able to leave the aorta. And then when this ventricle starts to relax again, sorry, that was a bit out of shot. When this ventricle starts to relax again, the blood will start to flow back down that down that aorta, but that valve will prevent backflow back into that ventricle. And then on the right hand side, you can see the wall of this right ventricle. Obviously you've got a bit of the septum, but this outer wall of this ventricle is a lot thinner than on the left ventricle. So again, you've got an atrium there, and the blood will be able to come in through the atrium, down through that open valve, into the ventricle. When this ventricle starts to contract, it'll contract from the bottom upwards. Blood will be prevented by these valves from going back into the atrium, but it will be able to leave up through here. If I can get my finger in, maybe need a little finger. It'll be able to go up through there, and you can see out through that pulmonary artery. So you've got these ventricles squeezing together, sending the blood out through these two arteries, one to the lungs and one to the rest of the body.